In this video, I'm going to discuss cervical spine stenosis. What is it and what are some things you can do at home to treat it? If you're experiencing cervical spine stenosis, you may not only be experiencing neck pain, but then also radiating symptoms down your arm and into your hand. Typically, the side that's being compressed or the side that narrowing has occurred, stenosis is basically narrowing, that is going to be the side that you're going to have the symptoms of pain or numbness down your arm or hand. What this is where you have these intervertebral foramen, these holes on each side. We have them down both sides of our cervical spine, and that's where our nerve roots and our nerves come out that go to the various parts of our body, primarily the upper extremities. And what's going to happen is you're going to either have compressed disc where the disc has lost height. That can cause some compression on the nerve roots there just because the bones can kind of sit down on one another. You also can have spurs that form due to arthritic change. There's a lot of arthritis in that area that can close off that opening for the nerves to come out, as well as we can have herniated discs, and that disc material can come out and take up this space as well. And again, that may cause this radiating pain and symptoms or numbness down your arm, into your hand, and as well as also cervical neck pain. You can have headaches, pain around the scapular region, the shoulder blade. Those are all common things. So we want to work on some stretches that you can do, as well as some soft tissue work, some things to kind of alleviate some of that abnormal muscle tone, and then some strengthening exercises as well. The first thing I want to work on is just basic stretches. So we're going to say that the symptoms are radiating down my right arm. So what you want to do in that case is bend the head away from the side that you're having the symptoms on. Because basically what you're doing is you're opening up that space where that nerve root or nerve roots come out. So you're going to bend away, and you're going to hold that somewhere between 10 to 30 seconds, and then come back, and you're going to repeat that. We can even do a little more aggressive of a stretch with that. So you can go down into cervical flexion. So you're going to bend your head forwards. And then what you're going to do is turn your head to the opposite shoulder. So remember, my symptoms are coming down my right arm. So I'm looking to my left and down. And then I'm going to take my hand and pull on the back of my head down towards, kind of towards my left foot area. You're going to feel that stretch on this side. You're going to hold that the same amount of time, 10 to 30 seconds, and repeat that several times a day. You also can use home TENS units, moist heat, ice packs, as long as your doctor or your primary care provider has okayed you to be able to use those. You've had some education on it, make sure you're safe to do so. You can use those in the area around the neck just to kind of calm things down, just to make things more tolerable so that you can tolerate your stretches, your exercises, and then just go through your daily life. This is going to be a cervical flexion with accompanied traction using a pillowcase. So what you're going to do is you're going to take the pillowcase, put this right behind the base of the skull. You're going to look down, and as I look down, I'm pulling the pillowcase forwards. I'm pulling this forwards, and I feel that stretch back there in the base of my skull, and my neck, my upper trap area. You're going to hold that for 10 to 15 seconds and relax. You're going to pull again, hold that for 10 to 15 seconds and relax. If you're unable to hold your arms in that position because you're having so much pain or weakness into the upper extremity, you can lie on your stomach and just let your head lie off of the mat or bed or whatever you have, couch, and just let that kind of sit in that position. That's just going to, gravity's just going to kind of help you with that stretch with that. You would do the same thing, hold that for 10 to 15 seconds and relax, and go again 10 to 15 seconds and relax. Now we're going to work on a little bit of those tender points or soft tissue areas that you get typically in the upper trap area, down between the shoulder blade. So what you're going to do is you're going to take one of these myofascial balls. You can also use a tennis ball if you'd like. Put it in a pillowcase. I like the pillowcase if you're going to stand up to do this because you don't want to keep dropping it and you have to pick the ball up. If you're going to lie on your back, on the floor, on the bed, that's fine. You wouldn't have to put it in a pillowcase. You could just lie on that in that position. So I'm going to put this over my shoulder here and lean back into this, just kind of that hurt so good sensation in the area. You may notice a radiating pain or symptom that comes up into the base of the skull, around your ear, just holding that pressure. I may work this up and down my spine. I may move this over to the back of the shoulder area, just all those places that typically you're going to have some of that radiating pain or you're going to have that increased tension. And that's something I would just hold for maybe 30 seconds if you can, several times a day. This is going to be a global nerve sliding and gliding technique. Now with this, you can go through specific nerve glides for the median nerve, the ulnar nerve, the radial nerve. Those are the three main nerves that are going to go down the extremity into the hand. I'm using this technique because I feel like it covers kind of all the nerves on both sides of the body. So what you're going to do is, regardless of the side you're having the symptoms on, you're going to take one hand, go above, so I'm in this position here. So I've got my wrist into extension, my elbow is flexed. My other hand, I'm going to take my wrist into flexion here. So my wrist is in extension on top, the bottom was in flexion. I'm going to go behind my back like this and straighten out my elbow. So if you can see, my elbow is straightened out, and then my wrist, my bottom wrist is in flexion, the top is in extension, and then we're going to flip around. So now the top wrist is in extension and the bottom wrist is in flexion, and I'm straightening out the elbow. Now we'll just go back and forth with that. You don't have to be perfect with that. Just go through the movements back and forth, repeat those 4 or 5 times, several times a day. This is going to be a seated shoulder and neck stretch. What you're going to do is, we're going to say it's my right side again that's affected. Grab a hold of the bottom of the mat here, or if you have a chair at home, if you're sitting in the chair, grab a hold of the bottom of that. I'm going to lean away, and then I'm going to take my hand and pull my head away from the shoulder and the side that I'm stretching, just to really stretch the nerves a little bit, open up those vertebrae a little bit, and just kind of relax the soft tissue. You're going to hold that for 10 to 30 seconds and repeat that several times a day. These are going to be scap squeezes or shoulder blade squeezes. You're going to take a band and you're going to pull on it, and as you pull, so I'm bringing my elbows back, I'm squeezing my shoulder blades together. So when you come back, you're really squeezing or pinching your shoulder blades together. At the same time, I want you to retract your cervical spine. So what you're going to do is kind of this retraction. So you pull your head back and you squeeze at the same time, come back forwards, retract, squeeze at the same time. And you repeat that for 2 to 3 sets of 10 to 15 repetitions. Our last technique is going to be deep neck flexor endurance training. So what you're going to do is lie on your back. And what you want to do with this is you're going to kind of tuck your chin in and lift the back of your head just slightly off of the surface that you're lying on. So I'm going to tuck my chin in, bring my head up. I'm going to hold that. You want to hold that somewhere between 10 to 30 seconds. You're working on being able to hold that for 30 seconds. That's kind of the norm for male and females, around 30 seconds. Just want to hold that so the back of your head is just slightly off of the mat. Initially, you may only be able to hold that for around 10 to 15 seconds, and that's fine. Just work towards that 30-second mark. Thank you so much for watching. I hope this video helps with your cervical spine stenosis, both understanding and treatment at home.